Have you recently been prescribed a high-dose vitamin D treatment and want to understand what it's actually for? Or are you curious why some people need a prescription strength version when vitamin D is available over the counter? That's exactly what we're covering today. Before we dive in, a quick note. This video is general information only. It's not medical advice, and it's not a substitute for guidance from your own doctor or pharmacist. Never start, stop, or change any medication based on what you see here. Always follow your prescriber's instructions. So, what is prescription strength vitamin D and why does it exist? Most people in the UK are familiar with standard over-the-counter vitamin D supplements, the kind you'd pick up at a pharmacy or supermarket. These are low-dose products designed for everyday maintenance. Prescription strength vitamin D is a completely different thing. It's a much higher dose, it's only available through a prescriber, and it's used as a therapeutic treatment for specific clinical situations, not as a routine supplement. In the UK, this type of treatment is prescription only for good reason. It's reserved for people with confirmed severe deficiency on blood tests, people experiencing symptoms like bone pain or muscle weakness, and those with conditions that affect how the body absorbs nutrients, such as coeliac disease, Crohn's disease, or people who've had bariatric surgery. These are situations where standard supplements simply aren't enough to correct the problem. If your doctor has prescribed this for you, they'll typically start with a short loading course. The schedule and duration will be set by your clinician based on your individual results. After that, you'll usually move on to a lower maintenance dose to keep your levels stable long term. Your prescriber and pharmacist will guide you on exactly how and when to take it. One thing worth knowing is that vitamin D is fat soluble, which means it's absorbed better with food. Many people are advised to take it with a meal, but follow your prescriber's or pharmacist's specific instructions on this. It's also important not to combine it with other vitamin D supplements unless your prescriber has explicitly said it's safe to do so. Now, monitoring is a really important part of this treatment. Before you start, your doctor should carry out baseline blood tests, checking your vitamin D levels, calcium, and kidney function. These aren't just a formality. They help confirm the treatment is right for you and give a baseline to measure your progress against. Follow-up blood tests during and after your course are equally important. The main risk with high-dose vitamin D, if not properly monitored, is a condition called hypercalcemia, too much calcium in the blood, which can affect the kidneys and other organs. This is why medical supervision throughout treatment matters so much. If at any point you experience symptoms like nausea, vomiting, confusion, excessive thirst, frequent urination, or unusual fatigue, contact your doctor promptly. These can be signs that your calcium levels need checking. It's also worth having a conversation with your healthcare professional about any other medications you're taking, since some can affect how your body processes vitamin D, and make sure you're clear on what your follow-up testing schedule looks like. To summarize, prescription strength vitamin D is a therapeutic treatment for confirmed severe deficiency, not a standard supplement. It's used under medical supervision, requires blood tests before and during treatment, and should always be taken exactly as directed by your prescriber or pharmacist. Don't add other vitamin D products on top without checking first. If you have questions about your prescription or your vitamin D levels, please speak to your GP, pharmacist, or specialist. They're best placed to advise you based on your individual results and medical history. Found this helpful? Give it a like and subscribe to the Bolt Pharmacy channel for more clear, straightforward health information. And if you have questions, drop them in the comments below.